guys, welcome back to A to Z Dentistry, and our today's topic is Hyperbaric Oxygen Therapy, also known as HBO, and today we will be studying about it in detail. So without any further delay, let's get started. So coming to the introduction, so first of all I would like to describe in detail what does hyperbaric oxygen therapy mean. So if we break it down, hyperbaric basically involves infusion of gas with a higher pressure, right? For example, in hyperbaric oxygen therapy, we give oxygen, that is 100% oxygen, at pressure which is greater than 1 to 1.5 atmospheric pressure. So hyperbaric basically means infusion of a gas with a pressure which is greater than the normal one. Okay, and oxygen therapy is very simple to understand. That means that we are giving oxygen to the patient at a pressure which is greater than that of normal. If we talk in terms of numerical value, it is about 1 to 1.5 atmospheric pressure. Okay, so moving on, hyperbaric oxygen therapy was introduced by Greenwood and Manius, particularly for radiation damaged tissues, right? So these are the names of the scientists who pioneered work with hyperbaric oxygen therapy. So it was first used in the treatment of gas gangrene. As we know that Clostridia is responsible for gas gangrene, and in that there is extensive necrosis and slowing of the tissue, right? The flesh becomes decomposed, there is putrefaction, necrosis involved. Therefore, by infusion of oxygen, we can try to kill the anaerobic bacteria which are responsible for the infection. So it was initially used in the treatment of gas gangrene. Now, over the last few decades, hyperbaric oxygen therapy has emerged as a potent alternative to surgical reperfusion, right? Now, mainly because various surgeries involve some or other kinds of injury, particularly if we talk about crush injuries, right? There is extensive necrosis of the tissue, and whenever there is necrosis of the tissue, the oxygen tension in the wound decreases, right? And because of this decreased oxygen tension, anaerobes get accumulate in that area and they cause infection. So by means of infusion oxygen, we are trying to kill all those anaerobic microorganisms which are responsible for the infection at the site of wound injury. So mainly this therapy was used initially and was largely limited to the treatment of gas gangrene and certain kinds of crush injuries and in cases of devitalized wounds. Coming to the definition, so hyperbaric oxygen therapy is defined as administration of 100% of oxygen to the patients placed inside a chamber which is pressurized to greater than 1 atmospheric pressure. This facilitates increased administration of oxygen to various tissues. Now, as we have discussed previously, that here we are treating the patient with oxygen at a pressure which is greater than normal. So we cannot give the patient oxygen anywhere at any time, right? There has to be a proper scheduled plan for the same. There has to be a particular chamber in which the patient will be admitted for a period of time, and within that chamber we will be infusing our 100% oxygen. So the definition itself highlights what pressure we are giving the oxygen to the patient and how it is given. So I hope the definition is very simple to remember. So let's move on further. So what is the rationale behind HBO therapy? So the most important aspect of this therapy is that it enhances the development of new blood vessels. This is also known as new angiogenesis. New basically means new, and angiogenesis means development of new blood vessels. So we know that during the proliferative phase of wound healing, we require increased amount of oxygen and oxygen is transported to the site of wound mainly by RBCs, right? So for that purpose we need increased amount of blood vessels which would be present at that site, so that we can have wound healing in a very quick way, right? So under the influence of HBO, what happens is that there is increase in the development of new blood vessels within that particular area. Also there is increase in the endothelial proliferation as well. So what happens is that due to increased amount of endothelial proliferation, all the necrotic and avascular masses which is lying there gets obliterated. Apart from this, many anaerobic flora gets destroyed because of this oxygen therapy. Also there are some bacteria which liberate endotoxins, and because of this continuous liberation of endotoxins, chronic inflammation is going on within the wound, which hampers wound healing greatly. So HBO therapy also serves to remove all those accumulated endotoxins, thereby facilitating wound healing. So these are some of the reasons why as to we prescribe a patient with this HBO therapy, and also we can say that these are the advantages. So basically it funnels down to one point, that we are artificially giving increased amount of oxygen to the patient so that we can have multiple benefits of the same. Increased amount of oxygen means the wound will heal quickly. First of all, it will kill all the anaerobic organisms. Second, it will also serve to destroy all the endotoxins which are liberated by those microbes. Thirdly, it will promote neoangiogenesis, development of new blood vessels, which will bring about fresh blood, more amount of oxygen to that area, and eventually it will be helpful in a quick recovery, that is quick wound healing. So now let's try to figure out what is the importance of HBO therapy in ORN, that is in cases of osteoradionecrosis. So first of all, let us have a quick review as to what is ORN. As the name itself indicates, there is necrosis of the bone following radiation. So sometimes what happens is that there is chronic infection already going on within a tooth, right? And when such a patient is exposed to any trauma and then the radiation, so it brings about a complex cascade of events wherein a chronic wound emerges out of it, right? And this leads to over time necrosis of the bone. Therefore it is known as osteoradionecrosis. But the important factor here in mind is that it is associated with a trauma and infection. The infection and trauma should be there, then only we can label the patient as a case of osteoradionecrosis. So let's move on to the importance of HBO therapy in cases with osteoradionecrosis. So basically, we know that radiation therapy is one of the mainstream therapy in treatment of various carcinomas, particularly the cancers associated with the head and neck region. So whenever a patient is exposed to such a radiation, we know that the radiations are powerful rays which have the ability to destroy the cells as well as bring about extensive damage to other body parts as well in general. So here the same thing happens. Radiation leads to increased amounts of hypoxia within the tissues. This leads to increase in the cell death and decrease in the vascularity to that particular area, right? So the tissues eventually become hypoxic, that is there is very limited oxygen present which is delivered to those tissues which are already being hampered by those radiations. And when such tissues which are already not in a condition to fight any kind of infection or a bacterial challenge are challenged by any kind of traumatic episode, such cells or tissues fail to heal. What happens is that हमारी जो बोन है, राइट, वो अब ऑलरेडी कॉम्प्रोमाइज़ हो चुकी है. it has been exposed to extensive amount of radiation, cell death हो गया है, there is no vascularity over there. एंड जैसा आप सोचे अगर कि हम कहीं जब गिर जाते हैं और उसके ऊपर अगर वापस से चोट लगती है, so there is increased amount of bleeding following the second trauma. Now this is because there hasn't been any repair yet, right? It has been only 24 hours or 48 hours or whatever the time period being, but there is no ability left in the tissues to fight again. So same things happens here. Already the tissues are hypoxic, already there is very little amount of blood vessels, very little amount of oxygen, so these tissues cannot actively fight any infection, or they cannot actively heal after they have been exposed to any kind of trauma. So what basically happens at microscopic level is that there is decrease in the fibroblastic proliferation, there is decrease in the collagen production, and therefore there is chronic non-healing wound. Now when we study about factors of wound healing, we know that fibroblasts play a very important role as far as wound healing is concerned, right? They lay down collagen, which forms a meshwork around the area which is necessary to protect the wound from any further trauma or infection. So because the fibroblasts itself are very sparse in this case, so they are not able to deposit the sufficient amount of collagen fibers which is required here. So therefore this results in a formation of a chronic non-healing wound. So as we know that the wound is chronic and it is not as strong as it should be, therefore it can be easily challenged again by any kind of bacterial infection particularly. So this chronic non-healing wound can be exposed to any kind of infection and it will make the situation even more worse. ऑलरेडी वहाँ पर इन्फेक्शन है, वो क्रॉनिक वूंड हो गया है, अभी इट हैज़ंट हील्ड येट, और फिर से अभी अगर उस पर बैक्टीरियल चैलेंज आ गया तो क्या होगा, वो और ज़्यादा बुरी तरीके से अफेक्ट हो जाएगा उतना एरिया. तो यही होता है, पहले क्रॉनिक ऑनगोइंग इन्फेक्शन रहता है, उसमें अगर फिर से कोई पेशेंट इम्यूनो कॉम्प्रोमाइज्ड है, मे बी डायबिटिक, हाइपरटेंसिव, वॉट एवर कमोबिडिटी, so already there are increased chances of infection and such a chronic non-healing wound further complicates the prognosis. और ऐसे ही केसेस में we can easily find osteoradionecrosis. Right? So now let's move on to what is the importance of HBO, why we need to deliver these increased amount of oxygen and how it can be useful to the patient. So basically what we are doing, our aim of giving this HBO therapy is that we need to increase the tissue oxygenation. हमने पहले पढ़ा था कि वो बेचारे सेल्स के पास कोई ऑक्सीजन नहीं है, ब्लड वेसल्स नहीं है, हम क्या कर सकते हैं, हम उनको बाहर से ऑक्सीजन दे सकते हैं. सेम थिंग वी आर डूइंग हियर, राइट? वी आर इंक्रीजिंग द टिश्यू ऑक्सीजनेशन. अब हम खुद जाके तो नहीं कर सकते, राइट? सो देयरफॉर वी आर गिविंग देम ऑक्सीजन बाय प्लेसिंग देम इन अ chamber, right? We are infusing increased amount of oxygen as at an increased pressure as discussed previously, so that एक ऑक्सीजन का रश हो जाए उस वुंड के अंदर और जो भी डेड नेक्रोटिक मटेरियल है वो पूरी तरह से ऑब्लिटरेट हो जाए, फ्रेश ब्लड वेसल्स उस जगह आए, प्रोलिफरेट करे, नई ब्लड वेसल्स आएगी और ऑक्सीजन लेके आएगी. जितना ऑक्सीजन अंदर आएगा उतनी ही स्पीड से सारे बैक्टीरिया, उनके टॉक्सिन्स वो पर्टिकुलर एरिया के बाहर निकल जाएंगे. जैसे ही बैक्टीरिया और टॉक्सिन्स निकल जाएंगे, our patient will be healthy, right? Now there is no chronic infection. Basically we are removing the focus of infection. We are killing all those anaerobic bacteria which are responsible for the chronic non-healing wound by giving our HBO therapy. Now this HBO therapy consists of 100% of oxygen which is administered to the patient at 1 to 1.5 atmospheric pressure. Right? This means that there is increased amount of oxygen delivery to our tissues. So I hope you have till now got some idea about this HBO therapy. So now let's move forward. So now let's try and understand what are the various modes of delivery of HBO therapy. So basically there are two modes via which we can deliver the HBO therapy. The most common one is the monopace chamber, and there is something known as multipace chamber as well. So as the name itself indicates, monopace means a single patient will be able to accommodate inside that particular chamber, and in case of multipace chamber, multiple patients can be accommodated within a single chamber. So some of the advantages of monopace chamber is that, first of all, definitely it would be a doctor can focus in a much better way while giving a therapy. We can easily monitor a single patient as compared to monitoring multiple patient. Second is that the chances of cross infection are completely eliminated in case of monopace chamber, and there are some chances of cross infection if at all multipace chamber HBO therapy is used. So let's move on to the frequency of this therapy. So this is the standard protocol which is usually followed for the cases of ORN, that is osteoradionecrosis. Each session ranges from 90 to 120 minutes, and in this the patient breathes 100% of oxygen, right, at 2 to 2.4 atmospheric pressure. Now this session, each session is termed as a dive, right, because it's like, when we dive into the water, same way here the patient is diving inside oxygen chamber. So a total of 20 to 30 dives are usually required, and these are given over a period of 5 days per week, and these are usually given pre-operatively. So this is a picture of how the multiplace and the monoplace chamber looks like. So the first picture demonstrates the multiplace chamber. As we can see here, multiple patients are accommodated in a single chamber here, right? So as I have told you previously also, increased chances of cross contamination is definitely there in these cases. Now this is a monopace chamber. Can you see here, it's a single chamber and the patient has been accommodated there, and he has been given this HBO therapy. So yeah, a doctor can better treat a patient this way because all the attention can be clearly focused to a single patient, and also the chances of cross infection are greatly minimized in such cases. So usually monoplace chamber therapy is more commonly practiced. So what is the procedure for this therapy? So first of all, we will scrub the exposed bone or the wound with antiseptic solution, and the antiseptic solution can be anything. Aminoacridine is a bactericidal antiseptic solution which is available, so this can be used as well, and we will cover that wound with neomycin dressing. We can use any other antibiotic dressing as well. So after this, we usually prescribe the patient with antibiotic so that we can have a microbe free area there. So antibiotic, the choice of antibiotic here is penicillin, erythromycin or tetracycline can be given as well. It is administered orally, and vitamin E is also given because of its antioxidant potential. 100 grams daily vitamin E tablets are also prescribed, and also these are given so that we decrease the chances of oxygen seizure. As discussed previously, we are exposing the patient to 100% oxygen, so a normal patient is obviously not used to such a extreme pressure as well as such an extreme percentage of oxygen. Therefore vitamin E is given prophylactically so that the tendency of oxygen seizure is greatly reduced. We will be placing the patient in a multiplace or a monoplace chamber, and oxygen concentration which we will be using is 100%. So the duration of this treatment can range anywhere between 1.5 to 2 hours, and it is usually given 5 days a week depending upon the patient. Apart from this standard protocol, daily wound irrigation is obviously required. We do not need any necrotic mass to be remaining there, as it can serve as a focus of infection all over again, and the cascade would again be initiated. We do not want any necrotic pieces to be remained there, right? So wound irrigation is a way to ensure that the area remains clean, sterile. So we'll basically irrigate the wound daily, and often in many cases debridement is required. See, this is because when the patient usually reports to us, it is already very late. There is extensive amount of necrosis which has happened there. So debridement is frequently required in such cases. Debridement is done again to remove the focus of infection. जब तक वहाँ इन्फेक्शन रहेगा, नेक्रोटिक बोन रहेगी, अनएरोबिक बैक्टीरिया भी रहेंगे और इन्फेक्शन वहाँ चलता ही जाएगा. हम बाहर से कितना भी एंटीबायोटिक देंगे, कोई भी थेरेपी करेंगे, पर जब तक इन्फेक्शन का सोर्स वहाँ प्रेजेंट है, पेशेंट सिम्टम फ्री कभी होगा ही नहीं. देयरफॉर द मोस्ट इम्पॉर्टेंट गोल हियर इज दैट वी try to remove the focus of infection. The same applies for osteomyelitis in general as well. Whatever treatment procedures we follow in the oral surgery department, it usually focuses on removing the focus of infection. Only then a healthy recovery can be expected, right? So after 6 months, 10 additional 2-hour treatments are usually advised. Now this can be followed by 10 treatments which are given annually thereafter. See, this is a very chronic condition, right? It cannot be an acute condition because उसका जो पैथोफिजियोलॉजी है वो एक प्रोलॉन्ग पीरियड में वो वूंड छोटे से आज इतना बड़ा हुआ है. सो देयरफॉर स्पीडी रिकवरी इज समथिंग विच वी डेफिनेटली कैनॉट एक्सपेक्ट इन सच केसेस एज द इन्फेक्शन इटसेल्फ इज़ वेरी क्रॉनिक. सो ऑब्वियसली द ट्रीटमेंट वुड बी क्रॉनिक एज वेल, राइट? एक लंबे ड्यूरेशन तक चलेगा पेशेंट का ट्रीटमेंट, एंड देयरफॉर टाइम टू टाइम हमको ऑक्सीजन देते रहना है बाहर से. एक बार पेशेंट रेडिएशन से एक्सपोज हो गया, कभी भी वो टिश्यू वापस एकदम हेल्दी स्टेट में नहीं आ पाता है. इट इज़ नॉट पॉसिबल, और आई कैन से इट इज़ वेरी वेरी रेयर. सो टाइम टू टाइम हमें बाहर से उसको कुछ ना कुछ ऑक्सीजन का सप्लाई देते रहना है ताकि वो वापस वहीं आके ना बैठ जाए जहाँ से हमने शुरू किया था, राइट? डेली वूंड इरिगेशन एंड डिब्राइडमेंट वी आर डूइंग, बट इवन आफ्टर दैट अ लॉन्ग टर्म फॉलो अप इज़ वेरी वेरी असेंशियल सो दैट ये कंडीशन वापस रिकरिंग ना हो जाए, right? So 2 to 3 main things which we have learned within this procedure slide. First is that we will be scrubbing the exposed bone with antiseptic solution. Superficially जितना भी necrotic material है इससे वो निकल जाएगा, right? Then we will be covering the purulent dressing with any antibiotic, right? After that we need to give antibiotic cover to the patient because chronic infection again, and we are prescribing vitamin E tablets to prevent the oxygen seizure tendency, right? After that we are giving the therapy according to the standard protocol, and daily wound irrigation as well as debridement it absolutely necessary, followed by a long term follow up. So let's talk something about the mechanism of action. ये therapy exactly काम कैसे करती है और ये क्या काम करती है, right? So as the name itself indicates, again it is a hyperbaric oxygen therapy. So our aim definitely is to increase the amount of oxygen which is delivered to the tissues here, right? Now mechanism of action will be directly related to the amount of oxygen which we will be delivering to the tissues. Therefore this increased amount of oxygen will be serving the following purposes, right? It will enhance the recruitment and function of the leukocytes, right? Then it will induce the fibroblastic growth, and therefore it will also enhance the collagen formation. Collagen formation is required so that we can have effective wound healing. It will stimulate angiogenesis, right? Angiogenesis is required so that we can have increased amount of blood flow to that particular area for the wound healing to take place quickly. It will also inhibit the anaerobic bacteria and aerobic organisms as well. It will also remove the endotoxins which have been liberated by those bacteria. See, some of the points mentioned here we have previously discussed it, so this will just serve as a bit of revision for you all, right? And the last point is that hyperbaric oxygen therapy increases the amount of oxygen in the tissue fluids, right, by a 10-fold factor. This is something which has been proven. So what is happening here, the depth of the oxygen which is delivered, right, to the lowest strata of the cells is also greatly enhanced, right? 10-fold increase in oxygen is a very significant figure. Therefore, even this oxygen delivery is not only related to the superficial tissues, but the deeper tissues are also being benefited here, right? तो जड़ से ही जो नेक्रोटिक मासेस है या बैक्टीरिया जो भी वहाँ पे हम उसी को निकाल रहे हैं via this HBO therapy. So this is what the mechanism of action of HBO therapy is, and I hope it is very easy to remember because 2 to 3 points have already been covered previously. The only new points here is that it will be enhancing the function of leukocytes and the 10-fold increase in the tissue oxygen levels. So now let's move further to the indications of HBO therapy. So now we already know that the ORN is one of the major indication for our HBO therapy. Apart from it, the indications have been broadly grouped under two conditions, right? The first one is in cases of any acute infection, that is any acute conditions, or any chronic conditions. So under acute conditions, it is helpful for the treatment of air or gas embolism, carbon monoxide poisoning, myonecrosis, that is caused by Clostridia. Then in cases of compartment syndrome as well as crush injury. Then in cases of decompression sickness, any kind of delayed radiation injury, in cases of very severe anemia, intracranial abscess, any kind of necrotizing soft tissue infections, thermal burns, then ORN, central renal artery occlusion, then idiopathic sudden sensorineural hearing loss. So basically, if we try to remember it, we can remember it in a very simple way. जितने भी cases में necrosis होगा उतने cases में हम definitely HBO therapy दे सकते हैं. As we have discussed, the aim of HBO therapy, the rationale behind is that we are trying to give increased amount of oxygens so that all the necrotic mass, the necrotic remnants, whatever is there in that wound are all flushed off. So basically any condition which will have a word necrotizing would be an indication for our HBO therapy. So it is very easy to remember. You can easily remember up to 6 indications, right? Starting from myonecrosis to crush injury, compartment syndrome. क्या होता है crush injury में? अगर कोई पत्थर या कुछ किसी की टांग पे गिर जाता है, राइट, पूरी मसल्स वहाँ क्रश हो जाती है. देयर इज़ नो ब्लड फ्लो टू दैट पर्टिकुलर एरिया, ब्लड वेसल्स आर एक्सटेंसिवली डिस्ट्रॉयड. क्या हो गया? ऑब्वियसली वहाँ नेक्रोसिस हो जाएगा. ब्लड ही नहीं पहुँचेगा तो उतना एरिया नेक्रोसिस में चला जाएगा. तो अब क्या करें, ब्लड कैसे पहुँचाए और ब्लड का क्या पर्पज़ है? मोर इम्पॉर्टेंट क्वेश्चन इज देयर दैट वाई डू वी नीड ब्लड? वी नीड ब्लड बिकॉज वाया ब्लड ऑक्सीजन विल बी डिलीवर्ड टू दैट एरिया, right? So main requirement here is that of oxygen only, which will be provided via the blood. पर अभी वहाँ पे blood vessels ही नहीं है तो blood कहाँ से जाएगा? तो ऑक्सीजन कहाँ से जाएगा? Therefore हम directly उसका रोल ही निकाल देते हैं, directly ऑक्सीजन देते हैं ना वहाँ पे, right? So this is what the exact rationale is here. So therefore it can be used in cases of crush injury, necrotizing conditions, any necrotizing soft tissue infections, even in case of severe anemia. Again, anemia में क्या होता है, right? There is decreased amount of oxygen tension, right? So we need more oxygen. blood का तो काम ही ऑक्सीजन पहुँचाना. अगर ऑक्सीजन ही नहीं पहुँचा पा रहा तो blood का यूज़ ही क्या है, right? Therefore, in cases of severe anemia also we can provide patient with HBO therapy. So the chronic condition is refractory osteomyelitis. As we know, osteomyelitis is again a chronic disease, and in some cases, particularly in immunocompromised patient, osteomyelitis can be refractory. So ऐसे cases में भी definitely we can give HBO therapy. Then in case of any compromised skin flaps or skin grafts, again graft क्यों compromise होता है? क्योंकि graft और जो donor रिसीवर एंड है वो प्रॉपरली जुड़ नहीं पाता, राइट. देर इज लैक ऑफ डेवलपमेंट ऑफ द अडेजन बिटवीन द ग्राफ्ट टिश्यू एज वेल एज द रिसीवर टिश्यू. तो HBO थेरेपी क्या करेगा? इंक्रीज अमाउंट ऑफ ऑक्सीजन रहेगा वहाँ पे, राइट. सो इट विल इन्हांस द न्यू एंजियोजेनेसिस, राइट. इट विल इन्हांस द ग्रोथ ऑफ एंडोथेलियल सेल्स विद इन दैट पर्टिकुलर एरिया, and it will ensure a proper blood supply to that area. So eventually the graft would adhere firmly to the receiver end. This is what we want, not this is the rationale for graft. We want it to be indistinguishable from that of our receiver site. So by giving HBO therapy in cases of compromised skin flaps or grafts, we can improve the prognosis of such patients. So up till now we have talked about the indications. Now let's talk about the contraindications, right. अगर indications है तो definitely contraindications भी रहेंगे. हम हर एक पेशेंट में तो ये थेरेपी दे नहीं सकते, राइट. सो ओनली अ फ्यू contraindications to remember. Just try to remember that pneumothorax is an absolute contraindication for this case, right. Other contraindications include asthma, then COPD, that is chronic obstructive pulmonary disease in case of optic neuritis, acute viral infections, URI, pregnancy, and congenital spirocytosis. So these are the cases in which our HBO therapy is contraindicated. Within this, just try to remember pneumothorax as an absolute contraindication. So let's jump on to the complications. अभी थेरेपी तो दे दी, बट कॉम्प्लिकेशंस भी तो पॉसिबल है, राइट. अप टिल नाउ आई होप यू हैव रियलाइज्ड दैट दिस प्रोसीजर इज अ बिट complex, you know. Placing the patient in a chamber means that we have to continuously monitor that patient. So definitely chances of complications are there. So the most common complication is decompression sickness. We know that we are changing the atmospheric pressure for that particular patient. So the moment the patient comes out of the chamber, there are increased chances of decompression sickness. Also, eustachian tube dysfunction can happen. Pneumothorax, again, it is an absolute contraindication and a complication of HBO therapy as well. And high pressure nervous syndrome, because the patient is not routinely exposed to such a increased amount, percentage and pressure of oxygen. So definitely high pressure nervous syndrome is a very common finding. It can happen. So even if you remember two or three complications, it's sufficient. I think decompression sickness, pneumothorax and high pressure nervous syndrome would be very easy to remember given the logic behind it. So here we are at the end of the major subheads which we have discussed. So to summarize it quickly, we have discussed something about the definition, we have discussed about the rationale, mechanism of action, various types of chambers via which HBO therapy is given, indications, contraindications and some complications associated with HBO therapy. Now let's move on towards our last section of this video, that is the exam tips. So as far as whole topic of HBO is concerned, there are certain questions which have been repeatedly asked. So two main types of questions. The first one is mechanism of action and the second one is the indications for HBO therapy. So the mechanism of action is very easy. I hope you all understood it very well and it is very simple and easy to grasp, right? Regarding indications, again just try to remember it as therapy which is basically involving giving patient increased amount of oxygen. So obviously it is helpful in any type of cases involving necrosis, large wounds, chronic wounds, right, crush injuries, compartment syndrome, and just try to remember it as HBO therapy. That means any kind of necrotizing condition, and you can easily write 6 indications. It is not a big thing. So that was all about HBO therapy, hyperbaric oxygen therapy. In this, there are no possible diagrams to draw. Only thing is, you can write the mechanism of action in a flowchart format. It would appear more pleasing in the answer sheet. So this summarizes it all. I hope you enjoyed this video. You understood about the HBO therapy. I have tried to make it as comprehensive as possible. So that was it for today. Bye bye. See you next time. Till then, don't forget to like, share and subscribe to my channel. This is Dr. Snail signing off. Bye bye.